The European Joint Action on Implementation of Best Practices in the Area of Mental Health, JA ImpleMENTAL, is a 3-year program. From the start, Iceland has been an active participant in the Supra part of the project, which focuses on the Austrian best practice model on suicide prevention. This presentation highlights the Icelandic journey. Suicide is a major public health problem worldwide with social, emotional, and economic consequences. The suicide mortality rate in Iceland is 11.7 per 100,000 on average for the last decade, which is an average rate compared to the Nordic countries. Prior to participating in the JA ImpleMENTAL program, Iceland had a strategic national action plan on suicide prevention dating back to 2018. That action plan had propelled some progress, but the JA ImpleMENTAL program provided much needed fuel and impetus for further progress. During the 3 years of the program, some important milestones were reached in the field of suicide prevention, intervention, and postvention, such as the following. The Minister of Health, the Honourable Willum Þór Þórsson, established a working group to create a new strategic action plan which fits well with the current approved policy and strategic action plan on mental health. An advisory board on suicide prevention was established at the Directorate of Health in Iceland. A situational analysis and a country profile were made along with a pilot action plan for the project. The concept of Yellow September was introduced and formally opened by the Minister of Health as the ministry stands behind the project along with the Directorate of Health, many institutions, NGOs, and representatives of people with a lived experience. The goal is to raise awareness, promote better mental health, change the narrative on suicides, and focus on coping strategies and resources. Iceland had already published material on suicide prevention, intervention, and postvention. To provide the public and the professionals with the most current information, these were reviewed, updated, and new material was translated and introduced in broad collaboration with stakeholders. Important steps were achieved when the Minister of Health secured permanent funding for a project manager on suicide prevention at the Directorate of Health. It was the prerequisite needed for the opening of a suicide prevention center in Iceland. The name Lífsbrú, or Life Bridge, was chosen for the center and a beautiful and symbolic logo designed. This year, for the first time, an individual and an organization were awarded a prize for suicide prevention from Lífsbrú Center of Suicide Prevention, based on Austria's Papageno Awards. Important working groups have been established with a different focus on suicide prevention, some working towards coordination of procedures, others with focus on training and collaboration. One of the groups is multidisciplinary and introduced updated guidelines for the media based on the World Health Organization guidelines from 2023. During the program, Iceland contributed regarding training sessions on both postvention and hotlines. Much has certainly been achieved, but we can always do better. There is no shortage of challenges, and further steps are needed to strengthen the effort of suicide prevention in Iceland. Funds must be raised for this project, simply to turn plans into action. For example, we still are struggling with waiting lists due to a lack of professionals in the mental health care sector. More must be done to combat stigma, prejudice, and shame related to mental health issues and suicide. More research is needed, as well as coordination of data in this field. We have learned that social contract and prioritization of mental health care is important. Collaboration and co-creation with all groups and individuals are vital. Nothing about us without us. Participation in Joint Action ImpleMENTAL has positively propelled progress in suicide prevention in Iceland. It has given us the opportunity to learn from and work with others, as well as creating new knowledge and strengthen our research. Networking is a key factor in that field. This project has also encouraged our healthcare professionals and helped to get the attention of politicians. Our sense of community makes our politicians want to contribute on an even greater scale than before. We are all in this together. We all play a part in suicide prevention. Together, we can make a difference.